segment that is Health Digest. Now, occupational and physiotherapy play a crucial role in the rehabilitation of patients diagnosed with Guillain-Barré Syndrome, a rare autoimmune disorder where the body, in a cruel twist, turns against its own nerves, weakening the muscles and can progress to paralysis after the immune system attacks one's peripheral nerves. On this episode of Health Digest, Gloria Milimu interrogates the role of rehabilitation in GBS management and what it takes for neuro-rehabilitative therapists to help patients bounce back to life after diagnosis. Let's take a look.
For Violet Amukonyi, a resident of Imara Daima in Nairobi County, these simple yet deliberate exercises are not just routines. They are stepping stones on her long road to recovery. Her diagnosis with Guillain-Barré Syndrome that left her body's defense mechanism mistakenly attack her peripheral nerves in 2022 resulted in muscle weakness and sudden numbness that in turn affected her mobility when the disease hijacked her immune system, leaving her muscles weak and her limbs numb. So vicious is the condition that it only took her 3 days before the network of nerves that carry signals from her brain and spinal cord to the rest of the body was severely affected, confining her to a wheelchair and leaving her in immense pain as she watched her body fail her.
I was in pain. I couldn't use my hands. I couldn't stand or walk. It took like 10 hours even for the hospital to come and understand what I was suffering from.
Like Violet, Joseph Yego from Langata recounts the abrupt turn his life took barely 3 months ago. What began as a tingling and numbness in his hands and feet quickly escalated into overwhelming fatigue, demanding urgent medical care. For both Yego and Amukonyi, it was critical for doctors to nail a definitive diagnosis and initiate treatment in time in order to reduce the severity of the disease and also shorten their recovery time.
I didn't know what was happening. Where I wake up in the morning, then I felt some numbness from the arm, from the foot and then the arm. So I told my wife, what could be the problem?
But for many patients, survival comes with a heavy price tag. Due to possible complications of muscle weakness, patients diagnosed with GBS are often admitted in the intensive care unit or the high dependency unit where the treatment is done from. However, this often leaves them raking in huge hospital bills, while for others, the cost factor makes the treatment journey a nightmare.
One dose was around 280,000. That's 7 bottles. We had to talk to friends.
It's very expensive, and most of the time you need this treatment immediately.
As people diagnosed with GBS begin to improve, rehabilitation is often recommended. This is because the condition can affect several parts of the body. Different methods and approaches of rehabilitation may be required at this point in order to help the patient regain strength and resume activities of daily living.
We support.
Neurorehabilitation expert Duncan Chengo says the journey begins with a careful assessment to help come up with an appropriate treatment plan for the GBS patient.
Sometimes we have had clients who are badly affected and therefore they even lack ability to sit. So you begin as low as just sitting, rolling from tummy to back, all those that entails gross motor movement.
From there, therapists tailor exercises to awaken weakened muscles, restore mobility, and even reteach patients how to perform the simplest of daily tasks.
Hand rehabilitation has a lot something to do with what we call the hand prehensions. And one of the most simple hand prehension is the grab and the ability to firm up your and then cause this to happen. Therefore, we give this, for example, you give this, so they all look different for purposes of making sure that you train the hand prehensions. So this is where we begin taking you back again to your office, because in your office you write, you type, you sign, and therefore you require what we call a 3-point pinch for you to then we come and we allow you to do simple functions like this one is the most textile bit of it. But just before we get you at this point, then we need to begin from a place like here. You can begin pulling from the big to the smallest, and then you continue, so it can develop also ability to firm up your fingers.
Hydrotherapy, which is also known as aquatic therapy, that involves exercises performed in water, may also be applied. Even so, muscle strength may not return in the same way. But Chengo says GBS patients should continue doing exercises as recommended, as this improves muscle strength. Guillain-Barré Syndrome strikes fast, crippling its victims in days. Yet, recovery can take weeks, months, or even years. Still, experts remain hopeful with the right care. Most patients eventually bounce back to life. And for the full recovery to take place, they must also be affordable for patients who grapple with the horrors of their bodies attacking themselves. Gloria Milimu, KTN.